Are you ready for rhinoplasty? Let's talk about it. Here I list 6 ways to know that you are ready for rhinoplasty. Number 1, you are of age. Now, what does that mean? So, noses and faces continue to grow into our teens, even into early adulthood. So typically, the age that the nose and the face stop growing is somewhere between 16 and 18 for young girls, young women, I should say, and 19 and 21 for young men. So if you are just within those ages or below that age, or the easiest way to know is, are you still growing in height? If you're still growing in height, then likely your face is still growing too, and so you are not yet ready for rhinoplasty. Number 2, you have good self-image. This may or may not sound counterintuitive, but really and truly, as a plastic surgeon who knows that plastic surgeons can prey on insecurities, and let's face it, our practice is not to exalt your insecurities. It's to really, really use them to encourage you to address them surgically, right? If I'm being all the way real. And so you need to come in with good self-image and dare I say self-respect, in order not to be swayed by a plastic surgeon who wants to erase you or erase your ethnicity, to be frank. And that brings me to number 3, and that is, you have found a surgeon who respects your ethnicity. Now, there is a woman on TikTok, and I hope that we can meet one day and talk about your story, who has been clowned recently, and there have been videos made about her and what that says about ethnic rhinoplasty or the lack thereof, and how Black and brown women should respect their bodies. Yeah, there's a lot of commentary about it. And I one day may share my own opinions about it if asked to do so. But the point I'm making here is that you should find a surgeon who wants to maintain your ethnicity, but also respect the changes that you want to make to feel more congruent with who you believe yourself to be, right? It is a very nuanced line. It's a very, very nuanced area, right? But the point is that there should be all the nuance in the world when it comes to your body, and all the respect for who you are as a person now, but also seeking to guide you towards who you want to look like or who you want to be. And it's something that should be a larger discussion, and should not be a one-size-fits-all rhinoplasty. If your surgeon has befores and afters and every nose looks the same, and the same is a little small refined tip, really pointy slope, that's not really respecting everyone's ethnicity. It just can't be. I think everyone may want the same nose, and that can be true too, but the question is why, right? The question is why, because we were all born to look the way that we look. And then this becomes a bigger ethical question about plastic surgery. I know that it does, but really, this is an individual choice. My body, my choice, right? So you need to have the conversation with yourself in the mirror to say, what is it that I truly want, and can this person provide it for me? And will they make me look like Cindy Lou from The Grinch? It's Cindy Lou, right? Yes, I think so. Number 4, you are patient. You is patient, you is kind. No, but seriously, you are patient. Rhinoplasties do not look great for the first few months, I would say, up till the first year, okay? As a person who does rhinoplasties, know that it takes a lot of patience from the surgeon side and from the patient side to feel like it's going well. And there will be days and moments where it does not feel like it's going that well. There will be days and moments where it feels like it's getting better. But the expectation is not that you leave there and within a week are completely happy with your nose. the expectation is that after a year, you're gonna be fully healthy with your nose. And I know that's a long time to wait, but that's exactly why it's important to have that kind of patience before making the final judgment on whether or not your rhinoplasty was a success. If at that year point you're still not satisfied with the result, that is more than fair, and that is why revisions exist. Before then, it's a little too soon. Number 5, you have realistic expectations. Again, given your ethnicity, how thick your skin is, what the surgeon says about your bony / cartilaginous structures, that surgeon should be helping you develop realistic expectations for what you will look like, not what content creator Y who got a rhinoplasty from a person in somewhere in Turkey looks like, okay? But for what you will look like. Remember, everyone heals differently and individual results will vary, and so they need to be expectations that you need to be realistic. And then lastly, the 6th way to know that you are ready for rhinoplasty, and that is you don't do any kind of drugs. Marijuana, sure, but there's no nicotine, there's no vaping with nicotine, there's no cocaine, okay? Those are dangerous for you, period. But especially when you're dealing with surgery and you're making demands of the skin to heal, you are actually really sabotaging yourself and your result if you do anything of the sort in the way of smoking, or that's true, period, but especially true if you're about to get surgery. So even if you only vape socially or you smoke a cigarette when you're really mad, that's not okay, all right? And you will have wasted probably thousands of dollars because you got your rhinoplasty too soon when you weren't ready. Questions and comments always below. Always, please like and subscribe. And always, love you lots, and bye for now.